Welcome back to the vlog. Today is part 2 of my video on metastatic cancer and how I typically treat it with something called Metronomic or low dose oral chemo. If you're finding this video, please hit pause. I promise I'll be here when you come back. But I would like you to watch vlog number 105, and that is where I go through what metronomic chemotherapy is and why I'm treating metastatic cancer that has spread, whether it's to the lungs, which is the more commonplace in dogs and sometimes cats, or the abdomen, with this type of chemotherapy. And I go through how it's different than maximum tolerated dose chemotherapy. In this video, I'm going to tell you the different drugs that I use that your veterinarian or your cancer specialist may talk to you about. Protocols can be a little bit different, so I'm not going to give you specific recommendations for your pet. I love to hear from you, but I'm not going to be able to make those recommendations. So please seek out a specialist or talk to your veterinarian about the questions regarding your pet. I do want to share with you a couple of the cases because, as I talked about in the last video, I really have seen some remarkable cases over the years. And before this type of chemotherapy, we didn't have many options for dogs and cats with metastatic cancer or cancer that has spread. So I'm going to tell you about Oprah, which was a case that I treated, and one of the very first cases, which was Reese's, and then we'll talk about the different drugs, and then we'll wrap it up. All right, let's break it down. So Reese's was, when I first met him, a 9-year-old male castrated pit bull, a pitty, and he was one of the very first dogs that I used Palladia, which is a mast cell tumor drug. So again, I talk about this in the last video, extra label use. So using it for something than what it's described for on the label, what it was FDA approved for. And it's okay, it's legal to do that. But he came to see me after he had been diagnosed with an anal sac adenocarcinoma, and it was metastasized. It had spread to his sublumbar lymph nodes and also to his lungs. And we're going to show you his x-rays. And his x-rays are the ones that, when I was a resident, we'd put up on the light box, or you put up on now on a computer, and just really, really bad because he had metastatic cancer spread throughout his lungs. He also was not feeling well when he came in, and he also had something called hypercalcemia, so high blood calcium, which is a negative prognostic factor for dogs with anal sac cancer. He had seen another oncologist, and they had tried maximum tolerated dose traditional chemotherapy. I had met him 2 months later, and we had done some things. I'm not going to go through all the details, but we had used steroids to try to get his calcium down, increase his appetite. But eventually I switched him over about 2 months into that onto Palladia. We're going to talk about the different drugs that I use in the protocol coming up. But eventually I got him on Palladia and low dose cyclophosphamide. And again, we'll talk about those different drugs. And we did a series of x-rays and followed him. And so we started him on Palladia. He was diagnosed around Christmas in 2009. I started him on Palladia in March of 2010. Again, he had been on some traditional chemo before that. We had used steroids to lower his calcium and improve his appetite because, as I talked about in the last video, it's really important that they're eating pretty well. We had used Serenia and things like that to get his appetite up. Entice was not yet on the market. And then I took x-rays 2 months later, and I was pretty excited with his x-rays. One, his quality of life had improved 2 months on the therapy. The radiologist actually thought that some of the nodules were smaller and less defined. So we talked about in the last video how we can have a slow response. So again, we were seeing some improvement, but he was gaining weight. His appetite was improving. He was having more energy. This was a really sick dog when I first met him. His coughing was improving. When you look at those x-rays, those radiographs, you're not surprised that, he was not feeling well when he came in. So when he was on the protocol for about, week 25, so now in September, so about 6 months into the protocol, some of the nodules were cavitated, but he did have more nodules and they were a little bit larger. So his quality of life sadly started to deteriorate the following month. So in October, the end of October in 2010. And he was humanely euthanized at that time. But this was a dog that lived 10 months with metastasis pretty significant metastasis, high blood calcium, and had a really poor quality of life when I first met him. And during the 6 months that we had him on Palladia with, all the other things that we did, he had a really improved quality of life, and the owners were really, really satisfied with that. And, if you had told me before that this dog was going to have a great quality of life 10 months with those x-rays that originally were taken in, December, right around Christmas in 2009, I would not have believed it. So pretty remarkable. The second case that I had a really good response was Oprah. And she was, when I first met her, an 8-year-old female spayed, recently spayed Doberman mix. Had a history of some mammary tumors. And so her chest x-rays were a little bit different, but she had 2 very large nodules in her lungs and then some smaller nodules that we saw on CT. So we determined that they were not resectable, not going to be, able to remove because she had 2 big masses plus other ones. We did aspirate the bigger one and it was carcinoma. We never were able to figure out, was it primary lung cancer that had spread to her lungs or mammary cancer that had spread to her lungs? There was no point of going to surgery with these 2 very large masses. So in December of 2013, she has a very huge mass in front of the heart and then a second large mass behind the heart. We decided to put her on this Palladia-based protocol with low-dose cyclophosphamide. She was on some supplements as well. As I talked about, this is a slow-acting protocol, so I usually do not take chest x-rays or follow-up imaging for about 2 to 3 months. We did take follow-up imaging in March of 2014, so she had been on the protocol for about 2 to 3 months, and things were pretty status quo when you look at the images that we'll show you. Our next set of films that I'm going to show you are in September of 2014, so about 6 months later. And we were pretty surprised as well. So the mass in front of her heart, towards the front of her body, was pretty much resolved. And the mass behind her heart, basically over the time period that I treated her, kind of waxed and waned in size, a little bit bigger, a little bit smaller. So you can see Oprah is continuing to come in. So now we're about a year after her diagnosis and she's in her Christmas sweater, and you can see her images as well. So again, mass in front of the heart remained gone, and the one behind her heart, closer to her diaphragm, to the abdomen, pretty stable. Oprah definitely got dressed up for many, many holidays when she came in, and that was always so much fun. She comes in for Halloween, all dressed up. She actually won the Halloween basket. So just a fabulous, fabulous dog. She remained status quo over the period of time. She was a dog that did have sterile hemorrhagic cystitis, one of the few dogs, I talk about that as we go through the drugs, that we did have to stop that. That was a side effect. So she was one of the few dogs over the years, but this was a dog who lived almost 3 years with those chest x-rays, which was pretty amazing. And Mom was very grateful for the time that she had. And again, just a pretty amazing response. So let me tell you about the drugs that we have. And it's just nice to know that there are options for dogs with, images like Reese's and like Oprah. And like I said, I have other dogs like Goliath and other ones. I've used this for other cancers as well. So it's pretty amazing in my humble opinion. And let me tell you about the drugs and then we'll wrap it up. Okay, finally, I'm going to wrap up with what are the different drugs that we use in this protocol. So typically we're going to use a low-dose oral chemotherapy and alkylating agent. The most common one that I'm using is low-dose cyclophosphamide. It's a drug that we use in higher dosages commonly in the lymphoma chemotherapy protocols for dogs and cats. It's usually going to be compounded into a size that fits specifically for your dog, usually given every other day or 3 times a week. But it can cause bladder irritation, so you're going to give it in the morning. So that's typically well tolerated. And then there are some other drugs as well. Leukeran, chlorambucil, that's one that has recently gone up in price. If your dog's having urinary side effects, that can be one that will be used, or relapses on cyclophosphamide. And then low-dose compounded lomustine is another option. I don't typically use that one, but it has been reported as another alternative option. So that's going to be your low-dose chemotherapy chemotherapy. Then you need something to target those blood vessels. That's often a non-steroidal anti-inflammatory or Palladia. Palladia, and I just saw a dog today, guys, that had metastatic cancer to the lungs. This actually, we knew where the primary was. The dog had a recurrent soft tissue sarcoma over the wrist, over the carpus, was originally removed almost 2 years ago, grew back about 1.5 years later, and then had a second surgery, and then just grew back about a month ago. We think that's the reason that has metastasized to the lungs. That's the lung nodules. And the owner was Googling, is like, why am I using Palladia, this mast cell tumor drug? So it's a drug that does target a certain mutation in skin tumors called mast cell tumors, but also has this anti-angiogenic effect. So it inhibits some other growth factors that are involved in blood vessel formation. So anti-angiogenic. So for dogs that have measurable metastasis, nodules, chest or abdomen, I usually will combine Palladia with cyclophosphamide. I don't start them together. I want to make sure they're tolerating the Palladia, and then I add the cyclophosphamide. They're on a stomach protectant as well, and you're going to go home with just in case medication as described in vlog number 93. In some cases, you may be on doxycycline depending on the protocol. Yes, that is a tick antibiotic at low doses that's thought to have an anti-cancer and anti-inflammatory effect. The exact protocol is something that's going to be discussed with you and your oncologist. We'll put links below on how to find an oncologist or talk to your veterinarian to see if they're comfortable managing this protocol. So that's really my summary, guys, about metastatic disease and metronomic chemotherapy. Like I mentioned, there are some other uses for it. Those incompletely resected soft tissue sarcomas. I've used it in incompletely resected hepatocellular carcinomas where none of the chemotherapy options work, and this has seemed to work in some of the patients. So it's definitely a good option to be considered. There are definitely side effects that you are going to want to talk to your oncologist about. Please find an oncologist. Remember, I can't make specific recommendations through YouTube, through Facebook, through Instagram. This is to give you an overview so you have a basis of information. I have found the majority of patients on this protocol with proper monitoring, with their just-in-case medications, can really tolerate this protocol quite well. Some dogs will need dose modifications. They will need their Palladia to be adjusted. Some dogs will need Cerenia before Palladia it's given 3 days a week. Some dogs will not. So every dog is an individual. And that's what I do with my patients, is modify everything to make sure they have a great quality of life. Like I said, I've had patients on it for 3 to 4 years where we've been able to stabilize their metastatic disease. And stabilizing metastatic disease for that long is pretty phenomenal in my humble opinion. So it's an option worth considering. I hope this information was helpful. Please leave me comments. Don't forget to subscribe. I'm sorry that you were here, researching metastatic disease. I know it's a crappy time. Again, I hope you found this information helpful. Oh, guys, one more thing. I also do have an information sheet, a sheet that I would be giving you if you were able to come see me in my practice. It's on my website, Dr. Sue Cancer Vet. We will put a link below. So that's a printed out sheet about metronomic chemotherapy as well, if you want to print that out, just to have something to read after you're done with this video. Thanks again for watching. I'll see you at the next video.